After China recently reported a mysterious outbreak of pneumonia cases in infants and toddlers, Netherlands is also experiencing a mysterious surge of pneumonia cases in 80 out of every 100,000 children in the age range of 5 to 14. Well, this marks the Netherlands as the second nation to report pneumonia outbreaks among children. The World Health Organization says that China has reported no unusual or novel pathogens in clusters of child pneumonia cases. In wake of the current crisis around the world, this is notably the largest outbreak of pneumonia the Netherlands Institute for Health Services Research has recorded in recent years. Even at the peak of the 2022 flu season, when pneumonia cases were most common, there were 60 recorded cases for every 100,000 children in the age group. Neither Novel nor the National Institute for Public Health and the Environment could explain the reason behind the sudden rise in pneumonia cases in Europe. Although China, in its reports, has claimed to the World Health Organization that no new pathogens were detected in the outbreak, the mysterious outbreak of pneumonia cases brings back the haunting memories of COVID-19 pandemic. The data submitted by China suggests that the sudden rise in pneumonia cases is linked to lifting on COVID-19 restrictions and winters. However, 4 years back in 2019, when the world was taken aback with the massive surge in mysterious cases of respiratory illness, its initial cases too had appeared in China's Wuhan during the winters. Before the countries could equip themselves well, the deadly pandemic had spread all across the countries, sparing none. Significantly, the current mysterious outbreak of pneumonia in China and the previous fatal outbreak of COVID-19 raises a question regarding why such deadly crisis always originates in China. Prior to COVID-19, many deadly pandemics have also originated in Beijing. The most devastating pandemic that emerged from China was the Black Death that ravaged Africa, Asia and Europe from 1346 to 1353, claiming between 75 and 200 million lives. Even the 1918 influenza pandemic, also known as the Spanish flu, was the deadliest of the century, killing 20 million to 50 million people globally. Some 500 million people, nearly 30% of the world's population at that time, were infected. A very valid reason why such deadly pandemics originate from China is the persistence of wild animal markets in China. In fact, civet cats, which are mammals that resemble a weasel, and pangolins, which are scaly, ant-eating mammals, are considered delicacies in parts of China. The People's Republic of China's National People's Congress had banned the trade and consumption of wild animals in February 2020 to prevent viruses such as COVID-19 from jumping from animals to people and spreading diseases. Earlier in January, the PRC had previously suspended the animal markets. While it is yet to be known if the current pneumonia spike in China is also attributed to any virus that jumped from wild animals to the common people, a warning regarding pneumonia has been released from ProMed, a disease surveillance system which had previously raised concerns regarding mysterious infection in Wuhan that later turned out to be COVID pandemic. According to the website Healthline, pneumonia can be a complication of COVID-19 and can cause infection in lungs. In case the SARS-CoV-2, the virus which causes COVID-19, multiplies, there are chances to develop pneumonia. Considering the sudden spike in the cases in Bharat's neighboring nation, China, the central government has asked the state governments to immediately review public health and hospital preparedness measures. The Bharatiya government added that it is monitoring the situation, stressing that there was no cause of any alarm at the moment.